Hey guys, and welcome to Gastro. So in today's video, we'll be talking a little bit about what is a CRP test, which is also commonly known as a C-reactive protein test. So this is actually one of the most commonly requested tests by doctors, physicians, and hospital staff around the world, and you'll see in a minute why this test is so important. So this test is usually ordered together with the full blood count or the complete blood count and is able to provide a great deal of clinical insight to the treating doctor or physician. So let's get started and talk a little bit about CRP. So before we get into the specifics of the CRP test itself, let's explore a little bit about what you can expect when a doctor orders a CRP test for you. So the CRP test is done with the taking of a simple blood sample. So a needle is used to draw blood from a vein in your arm into a serum separator or SST gold top blood tube. So as you can see in this little image down below, this is actually an SST tube, and the CRP test is actually measured through a blood test or a venipuncture or a blood draw. So the collected blood is then sent to a laboratory where it is analyzed and resulted. So now let's get into specifically what the C-reactive protein blood test is all about. So a CRP test or C-reactive protein blood test measures the amount of the level of CRP in your blood. So CRP is a substance that is produced by the liver in response to inflammation. So this is very important to note. So it is one of the group of proteins which is called an acute phase reactant that goes up in response to inflammation in the body. So the moment we have some sort of virus attacking certain parts of our body, say for example, we're currently experiencing a viral pneumonia, a signal is sent to the liver that there's current inflammation occurring in the body, and the liver produces these CRPs. So these CRPs are acute phase reactants, meaning they are short-term reactants of the body that spike in response to an inflammation. So the test is often used by physicians to detect inflammation in the body. It also monitors conditions that cause inflammation, and it assesses how well treatments for those conditions are working. So basically, in a nutshell, when these proteins increase in the body, it points towards an active or ongoing infection or inflammation in the body. So this will tell the physician or alert the physician that there is something wrong, there is a current infection or inflammation occurring in the body. And because this happens, it can actually be used as a very useful tool in assessing how well antibiotics, for example, are working in the body over time and if the inflammation goes down over time. So let's take another example. If you've got a patient that is coming through the ER with a high level of CRP that is determined in their blood, they are febrile, meaning they have a high fever, they are sweating, there is pain in the right upper quadrant, so you are querying perhaps a cholecystitis or a gallbladder bacterial infection. The CRP can be used as a very helpful tool if this patient is admitted and you start the patient on antibiotic treatment. The CRP levels should actually decrease over the following days that come. So after 3 to 5 days, you would see that CRP level dropping. So which means the inflammation of the body is actually going down, your treatment is working. So the CRP can actually be quite useful in monitoring the condition that is causing inflammation and to also assess how well that treatment is actually working. So it's quite a useful tool in everyday medicine. So as we mentioned before, elevated CRP levels can be indicative of a variety of issues such as acute bacterial, fungal, viral, or parasitic infection. The CRP levels also tend to rise in cases of cancer, a heart attack, chronic diseases, and even some autoimmune diseases like rheumatoid arthritis, lupus, inflammatory bowel disease, and rheumatic fever. It's very important to note that this is a non-specific test, which means it doesn't pinpoint the exact cause of inflammation, but does alert to the doctor that a current inflammatory process is occurring somewhere in the body. So as you can see, there are quite a few different causes for the increase in CRP, Therefore, it's a non-specific test. It does alert us to some sort of inflammation occurring, but doesn't pinpoint the exact cause. So by a process of elimination, we'll have to work through all of these to rule out what the actual cause is. So normal CRP levels are typically very low and are usually under 10 milligrams per liter in a healthy individual. So if we had to speak about the clinical relevance of the CRP level, usually under 10 would be quite normal in a healthy individual, but for clinical relevance purposes, less than 3 is normal, mild elevation, meaning some sort of light inflammation in the body, 3 to 10 milligrams per liter, and moderate to high elevation means anything greater than 10 milligrams per liter. So as mentioned before, high levels of CRP suggest infection or inflammation, but is often used alongside other tests to get a clearer picture of a person's health. So there are also certain medications that can cause your CRP levels to be lower than normal, and these include the NSAIDs or the non-steroidal anti-inflammatory drugs, aspirin, and steroids as well. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this video quite insightful to get a generalized picture of what the CRP test is all about. Please make sure to like, comment, subscribe, and share this video with anyone you think might find this video useful. Take care and have a great day further. Bye for now.